Today's session will be on development of gonads. I've got many requests asking to give a detailed session on development of gonads, so I will be trying to do the same. So first of all, before going to the development of gonads, many authors differ in opinion regarding some of the regions. So I've taken a general consensus and I will be dealing with the development of gonads in a nutshell. So first of all, when is or what are the features which determine whether a fetus is going to be a male baby or a female baby? It is said that up to 5 to 7 weeks of intrauterine life, the development of genital system is almost the same. Then what is happening, or what are the factors determining whether the fetus is going to be a male baby or a female baby? Let's see what are the factors. The first and foremost will be the chromosomes. At the time of fertilization, whether the embryo is getting the X chromosome or the Y chromosome, that determines the sex of the fetus. So it is first the chromosomal thing which is determining the sex of the fetus. The next thing is the SRY gene. The SRY gene is known as the sex determining region in the Y chromosome. That will determine whether again fetus is going to be a male or a female. So which are the factors? So the SRY gene will be actually resulting in the formation or inducing the formation of two main cells. They are the Leydig cells and Sertoli cells. The Leydig cells are actually derived from the mesenchymal cells and the Sertoli cells are derived from the sex cord cells. What are mesenchymal cells and sex cord cells? We'll be coming to the details of it. For the time being, the SRY gene will be inducing the formation of Leydig cells and Sertoli cells. The Leydig cells will now produce testosterone, which will again induce the formation of genital ducts in male. And at 18 weeks of intrauterine life, the Sertoli cells will disappear and it will reappear only at the time of puberty. And what is the role of Sertoli cells? Sertoli cells will secrete a substance known as Mullerian inhibiting substance. Mullerian inhibiting substance means it will inhibit the Mullerian ducts. Mullerian ducts are the ducts which are seen in females. So that ductal system is actually inhibited by the Sertoli cells. So as a result, the Mullerian ducts are inhibited from the entire system and the testosterone will be inducing the formation of genital ducts from mesonephric ducts. This is actually what is happening at the 7th week of intrauterine life. So it is mainly the chromosomes, the X or Y, and the SRY gene, the sex determining region on the Y gene, which is actually resulting in the formation of testes. If this is not present, if SRY gene is not present, it will automatically get converted into an ovary and the fetus will be ultimately a female baby. Now let's see what are the changes happening. This is actually a section taken at the lumbar region, because these gonads are developing at the lumbar region. So this is a section taken at the level of lumbar region. This is the neural tube, this is the notochord, this is the gut, especially the hind gut, and this is the mesentery, dorsal mesentery. So this is the dorsal aspect and this is the ventral aspect. You just imagine a section taken at the lumbar region of the fetus. So at the dorsal region we have the neural tube followed by notochord, and you have the dorsal mesentery, which is actually suspending the hindgut from the posterior abdominal wall. Now let's see what are the changes happening. On either side of the dorsal mesentery, we have this region is actually known as the mesonephric region. On either side we have the mesonephric region. So the medial aspect of the mesonephric region, this is called the medial aspect of the mesonephric region. So the lining epithelium, this is called the coelomic cavity, where you have the hindgut suspended by the dorsal mesentery. So the lining epithelium of the entire cavity will be the coelomic epithelium. This region is called mesonephric region on either side of the dorsal mesentery. This medial aspect of the mesonephric region will get thickened to form a ridge known as genital ridge. So this is known as genital ridge. And we can see the primordial germ cells. Actually, again, there are many theories suggesting the origin of primordial germ cells. According to the mostly accepted theory, primordial germ cells are derived from epiblast. You remember the trilaminar germ disc where we had epiblast, hypoblast and the intervening mesoderm. So from the epiblast, the primordial germ cells are derived and they are seen around the hindgut, and through the dorsal mesentery it will reach this mesonephric region. So till then the primordial germ cells have not decided whether it is going to be a male, that is the spermatogonia, or a oogonia. So what is the determining factor? So before that, let's see what is happening in this region. This thickening is called genital ridge, and this genital ridge has got an outer cortex and an inner medulla. So the outer cortex and this region is called the medulla. So if the primordial germ cells are getting deposited in the medulla, you have spermatogonia developing from the primordial germ cells. If the primordial germ cells are going towards the cortex, you have the primordial germ cells developing as oogonia. So that is a generalization. The primordial germ cells, up to this region have not decided whether they are going to be a spermatogonia or an oogonia. So if it is going to the medullary region, it will be getting converted into a spermatogonia, and if it is going to the cortical region, it will be getting converted into an oogonia. Now we are going to focus this region. So these are the sections. We are just focusing on this region. So before that, there are two ductal systems. This is called the mesonephric duct. In the mesonephric region, we have two ductal systems. This is called the mesonephric duct system, and next to it we can see another duct system. This is called para-mesonephric duct. So this is called the mesonephric duct, and nearer to it, adjacent to it, hence it is called para. This is called para-mesonephric duct. Here also we have the mesonephric duct, and this is called the para-mesonephric duct. So the mesonephric region, we have two duct system, mesonephric duct and para-mesonephric duct, and a medial thickening that is called the genital ridge or gonadal ridge, from which we have the development of gonads. All these events are occurring at the level of lumbar vertebra, lumbar region. Now let's see what are the events occurring in a male. This is female and this is male. So let's see what are the events occurring in a male. We have already mentioned that this thickening is called genital ridge or gonadal ridge. That is actually the thickening of the germinal epithelium. Now what happens? From this, many cells are actually growing towards the medulla. These cells are known as sex cords. These cells are known as sex cords. Once the primordial germ cells reach this region, we are talking about a male. Once the primordial germ cells reach this region, they will get embedded between the sex cord cells. You can see these red colored cells are the primordial germ cells. So these cells will get embedded in the sex cord cells. Okay, and we can see the duct system here. This duct is called the mesonephric duct system. Okay, so we have the mesonephric duct system and the primordial germ cells getting embedded in the sex cord cells. Now what is going to happen? Since it is a male, the para-mesonephric duct system will just regress because there is no need for a para-mesonephric duct system. So now we are going to see the changes happening in the mesonephric duct system and the sex cord cells. The sex cord cells will actually canalize to form the seminiferous tubules. So these are the seminiferous tubules. The sex cord cells will canalize to form the seminiferous tubules. And the cells which are not canalized and the cells which are present in the mesenchyme will give rise to the formation of Leydig cells. That is the reason why we mentioned here it as Leydig cells are derived from mesenchymal cells, and the Sertoli cells are also derived from the sex cord cells. So we have the sex cord cells getting canalized to form the seminiferous tubules, and along the seminiferous tubules we have the primordial germ cells which are the spermatogonia lining the seminiferous tubules. The cells which are not canalized and the cells which are present in the mesenchyme will be forming the Leydig cells, and the Sertoli cells will also be formed within the sex cord cells. Now, all these seminiferous tubules will anastomose to form Rete-Testis. Now, what is happening to the mesonephric duct system? The mesonephric duct system will go nearer to the Rete-Testis, and the mesonephric tubules, these are the mesonephric tubules, this is a mesonephric duct and this is a mesonephric tubule. Mesonephric tubule will make a contact with the Rete-Testis to form vasa efferentia, and the mesonephric duct system will form epididymis. So actually the part which is lying nearer to the testis will form epididymis, and the part which is lying away from the testis will form the ductus deferens. So this is an adult testis. If you take a cross section, it will be looking like this. So these are the seminiferous tubules. Here you have the Rete-Testis and the vasa efferentia, which will be joining to form the epididymis. So the vasa efferentia is actually derived from the mesonephric tubules, and the mesonephric duct, the proximal portion will nearer to the testis will form the epididymis, and the distal portion will be forming the ductus deferens. This is called the ductus deferens, and ultimately it is opening into the prostatic part of urethra. You know that. So before it reaches the prostatic part of urethra, it gives off a diverticulum. The mesonephric duct, the distal part of the mesonephric duct will form a diverticulum. That is called the seminal vesicle. So the part of mesonephric duct lying between the seminal vesicle diverticulum and the opening in the prostatic urethra, you call this portion as ejaculatory duct. Ejaculatory duct. So that is what is happening for the mesonephric duct system. Now there are many remnants. Sometimes the mesonephric tubules may persist, which are the mesonephric tubules which are not forming vasa efferentia are forming two sets of duct system. Let's see what are they. Superiorly, they will be confined to the testis. They are not making any communication with the epididymis. So this is called superior aberrant ductules. Superior aberrant ductules. Sometimes these mesonephric tubules will be persisting in the inferior aspect, and they will be communicating with the epididymis alone. It won't be communicating with the testis. They are called inferior aberrant ductules. So superior and inferior aberrant ductules, they are the remnants of the mesonephric tubules, because the main mesonephric tubules will be forming vasa efferentia. So the ones which are remaining confined to the testis, you call it as superior aberrant ductules. The confined to the epididymis, you call it as inferior aberrant ductules. And again there are some which are not making any communication with the testis or the epididymis. They are known as paradidymis. This is called paradidymis. Sometimes a cap-like thing will be seen at the head of epididymis. This is called appendix of epididymis. Appendix of epididymis. So appendix of epididymis is again a remnant of mesonephric duct. Suppose if you get a cap-like thing over the testis in the upper aspect, what do you call? This is again appendix, but this is not a remnant of mesonephric duct. This is a remnant of paramesonephric duct. Paramesonephric duct, because paramesonephric duct usually degenerates if it is going to be a male baby. So there are two appendices, you should not confuse. Appendix of epididymis is actually a remnant of mesonephric duct, whereas appendix of testis is actually a remnant of paramesonephric duct. So these are the changes happening for the testis. Now we have already mentioned that the testis, the gonad, is developing at the level of lumbar region. That is why we have taken a section, cross section at the level of lumbar region. But we already know that we are seeing the testis in the scrotal sac. So how is the testis brought back into the normal position in the scrotum? Again, there are many theories. I will be just mentioning two or three factors which are going to determine the position of testis. The first and foremost is the developing of the body, the growth of body. So with the growth of body parts, the testis will just try to descend down. The next thing is a structure known as gubernaculum. A structure known as gubernaculum testis. It is a fibrous strand. So a fibrous strand will be getting attached to the lower aspect of the testis, and the other end of it will be attached to the scrotum. So this gubernaculum testis will act as a pulling agent to bring the testis into the scrotal sac. Some even say that the length of the gubernaculum testis remains the same, so that when the body wall is growing, it will remain the same and the testis won't be able to ascend along with the lengthening of the body wall. So it will be confined to the scrotal sac. So there are many theories whether it is due to the pulling effect of the gubernaculum or the unchanged position of the gubernaculum, which is resulting in the pulling effect of the testis. So anyway, it is the gubernaculum testis, the second factor. The third factor is processus vaginalis. Processus vaginalis is actually a peritoneal sac. If the testis is lying here, you have a peritoneal sac developing in close relation with the testis. This will actually help the testis. So if you have the testis here, you have a processus vaginalis, which is a peritoneal sac like this. So this will actually descend, and through the inguinal canal, this processus vaginalis will descend into the scrotal sac. Along with the descent of this processus vaginalis, the testis will be carried into the scrotal sac. That is another theory. So processus vaginalis, and of course the hormones also play an important role. So what usually happens is the processus vaginalis, once it reaches the scrotal sac, it will detach its connection with the abdominal cavity. So the remaining part of processus vaginalis will be forming a covering for the testis that is known as tunica vaginalis. Tunica vaginalis. Sometimes this connection may remain like that and we get hernia, or that is, since it is patent, anything from the abdominal cavity can easily come into the scrotal sac through the patent processus vaginalis. That is one of the reasons for inguinal hernia. Sometimes there will be a fluid collection in the patent processus vaginalis, that is called hydrocele. So these are the two clinical applications which you get when the processus vaginalis is remaining patent. So let's see how the testis is descending. By the end of third month, it will be reaching the iliac fossa. By the end of third month of intrauterine period, it will be reaching the iliac fossa, and by 7th month, it will be reaching the deep inguinal ring. And it will be traversing the inguinal canal during the 7th month of intrauterine period, and by the end of 8th month, it will reach at the level of superficial inguinal ring. And just before birth, it will almost occupy the scrotal sac. Sometimes even after birth, you will be getting a missed testis inside the scrotal sac, and before doing any corrections, you can even wait for a few months. So that is how the testis is descending along the inguinal canal. Now, what are the anomalies you can expect as far as the development of testis is concerned? Sometimes the testis will be absent on one side or both sides, or sometimes the testis may get fused with each other, or sometimes the testis may fail to descend into the scrotal sac. That condition is known as cryptorchidism. Cryptorchidism is a condition where the testis fails to descend into the scrotal sac. So what will happen if the testis fails to descend into the scrotal sac? So there are high chances of getting tumors in such a testis, and the spermatogenesis won't be happening at a normal level when compared to the normal testis. So these are the changes, or these are the clinical things which you can expect if the testis is not descending into the scrotal sac. Now there is another condition known as ectopic testis. Ectopic testis means if the testis is not seen in the normal position. So it can be seen just beneath the skin in the abdominal region, it can be seen beneath the skin in the perineal region, or it can be seen anywhere along its descent. So these are the other options. So these are the anomalies which you can expect. The main things are cryptorchidism, ectopic testis, and if you have persistent processus vaginalis, you may get inguinal hernia, congenital hernia, or you can even get a hydrocele. So these are the events happening if it is going to be a male baby. Now let's see what is happening if it is going to be a female baby. If it is going to be a female baby, the main thing is the mesonephric duct system. So this is a mesonephric duct system. It is not needed if it is going to be a female baby, and it is a paramesonephric duct system which is actually developing into uterus and uterine tubes and vagina. But I am not discussing about the paramesonephric duct system because it is, in case of female, the oogonia is not having any, the ovary is not having any ductal system as in case of testes. So what are the changes happening? We have already mentioned that the medial thickening is known as the genital ridge or gonadal ridge, and similar to what is happening in the testis, the next step is proliferation of the sex cord cells. That is same whether it is a male or a female. The next difference is the primordial germ cells, when they reach here, a single primordial germ cell will be actually encircled by the sex cord cells, and this will form the primordial follicle. So this is not a tubular fashion which you get in case of females. So the primordial germ cell, each primordial germ cell which is going to be an oogonia will be surrounded by sex cord cells, and they will be forming the primordial follicles. At this point, I would like to add one feature which is happening in male and which is not happening in female. In male, the mesenchymal cells will form a fibrous tissue around the seminiferous tubules. This is called tunica albuginea. Tunica albuginea. So once this tunica albuginea is formed, it will separate the seminiferous tubules from the germinal epithelium, and no more contribution will be there from the germinal epithelium. But in case of females, no such tunica albuginea is formed. So when you take a section, histological section at this region, you will get an outer germinal epithelium in case of ovary, but you won't get an outer germinal epithelium if you take a section of testis. So that is the reason. Tunica albuginea, which is formed in testis, will separate the germinal epithelium from the seminiferous tubules, and when it descends, it is not carrying the germinal epithelium along with it. But in case of ovaries, the germinal epithelium is still covering the developing follicles, and when it descends down, it is carrying along with it the germinal epithelium. So if you take a section and if you look it under a microscope, the outermost covering will be the germinal epithelium, which is lacking in case of testis. So the reason is the formation of tunica albuginea. Now again, the ovary is also formed at the lumbar region, so again it has to descend. So similar to the gubernaculum testis, we have the gubernaculum ovary. So one end is attached to the pelvis, the other end is attached to the labium majus. So that is how the gubernaculum is working. So with the advent of uterus, a part of it is getting attached to the junction of uterine tube and the uterus. So we can now name the parts of gubernaculum ovary. The part of the gubernaculum which is getting attached to the pelvic wall, you call it as suspensory ligament of ovary. Suspensory ligament of ovary. The part which is getting attached from the ovary to the posterior aspect of uterine tube, you call it as ligament of ovary. And the part which is getting attached to the anterior aspect of uterine tube up to labium majus, you call it as round ligament of uterus. So these are the parts which are formed from the gubernaculum ovary. Suspensory ligament of ovary up to the ovary from the pelvic wall. From the ovary to the posterior aspect of the uterine tube, you have the ligament of ovary, and from the anterior aspect of the uterine tube up to the labium majus, you have the round ligament of uterus. So these are the things which are developing from the sex cord cells. So we have mentioned that mesonephric duct system is actually vanishing in case of if it is going to be a female baby. Sometimes it may persist. So what will happen if it is persisting? It is seen as three structures. If it is seen above the ovary, above, it is called epiphoron. If it is lying below, this is called parophoron. Parophoron, it is actually lying between the ovary and the uterus, and sometimes the duct system, so these are the tubules, the epiphoron and parophoron, and sometimes the duct system may persist, and it is known as the Gardner's duct. Gardner's duct. So these are the remnants, if at all present, which you get in a female baby: epiphoron, parophoron, and Gardner's duct. The paramesonephric duct in case of females are not having a direct communication with the gonads, and they will be developing as uterine tubes and uterus. So these are the changes which you can expect, and what are the anomalies which you can expect in case of ovary. Ovary, again, it may be absent on one side or both sides. It may fail to descend, so along its course you may get ovary, or sometimes ectopic ovary you will get, and sometimes instead of the primordial follicles you will get primordial germ cells which are developing into any kind of any cell type. So you may get a bone, a cartilage, or skin, or hair inside the ovary. Such conditions are known as teratomas. So these are the anomalies which you can expect in case of ovary. And there is one more clinical application, that is known as hermaphroditism. Hermaphroditism, true hermaphroditism is not usually seen. We have one female hermaphroditism and a male hermaphroditism. If we say female hermaphroditism, the patient will be having the female gonad, whereas the external things will be that of a male. If you say it as a male hermaphroditism, the patient will be having a male gonad, whereas the external things will be that of a female. So there are no true hermaphroditism in case of human beings, but still we will say if you get a gonad of a female, you call it as a female hermaphroditism, whereas external things will be that of external genital system will be that of a male, and vice versa. So that's all about development of gonads in a nutshell. Thank you.